What I talked about today was about the treatments in sickle cell disease. So sickle cell disease is an inherited blood problem that's characterized by the presence of a variety of acute illnesses. These patients also have a high risk of having organ dysfunction, and all of these things contribute to them having a shortened life expectancy. And so what I talked about were the new treatments and kind of some of the old treatments that we have available. So for one, we know that sickle cell disease can be cured by bone marrow transplantation, and there's also increasing evidence that gene therapy is a potential treatment for these patients. Although these two treatments, bone marrow transplant and gene therapy, are potentially curative, they are quite expensive. And most patients with sickle cell disease reside in areas where they do not have access to these treatments, and so it's very important that we develop other treatments that are not only effective but safe and affordable for these patients. So I think, so my hopes, obviously, try and continue to push the bounds of science, but even more so is developing treatments that will be available to patients who live in resource low regions, so that these patients can have an improved quality of life and a prolonged life expectancy as well. Yeah, so I think, so for one, research is helpful. So if we do more studies and research, we'll develop the treatments. But then there has to be significant investment from all the available stakeholders, so government, pharma, academia, and all kinds of interest groups.